Hi, this is Thalia MK at Health 2.0 Conference Dubai Winter 2022, and I have with me Dr. Sarah Mandalawi. She is School Director, Medical Director for GEMS Al Barsha National School, and she was awarded for outstanding leadership. And if you are from Dubai or Middle East, you know how big GEMS is, and she was awarded for that. Thank you so much for being here. Me being a resident of UAE Dubai, we know how good and amazing GEM School is. And you being awarded, that means the work you have put in was the right way. Congratulations. Please tell us about school director and medical director, what it is and what is your job.
Thank you so much, Talia, for this introduction. And I'm so happy to be here, so privileged to be here. As you mentioned, I'm the school doctor and medical director at GIMS Al Barsha National School at the well-known GIMS Education worldwide chain. I joined 2.5 years ago, and since COVID, and it's been a lot of work, a lot of pressure to keep my students and my staff safe, especially during the COVID era. Close contact tracing. It was all about COVID. I'm so happy that now we get to breathe. I get to see my students' faces again, their smiles, and we get to focus on other aspects of health other than COVID. I take care of 1,100 students plus 250, around 250 staff members on a daily basis. First aid, providing first aid for them and consultations as well, referring them in cases of emergencies. And believe me, there is never a boring day in school. Every day you have something, you have an emergency, you have something, you have to run away, to run to help your student or your staff member. I also consider myself as a mental health advocate. I raise awareness about mental health in my school and outside my school, and I'm part of a safeguarding team. I safeguard my student and my staff. That is very important to protect our students from any kind of abuse.
I was about to ask you about as you mentioned already about medical and health. After pandemic, school is something everybody know what school is. There is a teacher, there is a student, and there are subjects. A basic traditional school. But after pandemic, I don't think so. The things are similar to as traditional as it was, years before. What is your strategy now after the COVID and to prevent future, God forbid, any problems or to prevent any of these scenarios again in the future? What are your go-to goals and what are you implementing in your school? And apart from that, when it comes to mental health, what your school is doing and helping students out, like how they are doing it?
Well, that's a very important question. Thank you for asking. I'll take the first aspect. You asked me about how we try to, what do we do to prevent any future diseases or outbreaks in my school. Well, as part of GIMS education, we set down certain policies, very strict policies and health policies under the government, the Dubai Health Authority's guidelines. I oversee and see and examine 6 students every day. I get to, of course, I have a no stay at home policy that they need to stay at home if they're sick or showing any symptoms. You need to follow the guidelines. Sometimes you need to fight, you need to convince the parents because they will be upset. I can feel them, and because they're there to educate their children, not to send them home, but safety first. Their health is number one for me and for my senior leadership team and my administration. So I send them home whenever they're sick. I refer them to a specialist doctor if I couldn't help them, because I have the ability to help them in school after taking the parents' consent, of course. But I refer them for further investigation if they need a PCR or they need influenza test. I know we are almost over with COVID, but we have other diseases like influenza, and there was an outbreak just recently in my school. So parents they were very frantic about it, but you have to, awareness. You have to make people aware about the disease, how to prevent it, how to take care of themselves, wearing masks if they are showing any symptoms, and just keep the habits that we took after COVID, like sanitizing your hands. And we need to keep on emphasizing on hygiene. It's very, very important. Mental health and safeguarding is a personal and a professional kind of pursue. I run workshops in my school, raising awareness for my secondary students and primary student. But secondary is my concern because they are teenagers now. They face some problems, and I get to see a lot of students that come with panic attacks. They come with anxiety, exams. So you need to calm them down. You need to be their friend and try to just help them out. Of course, it's not a one man job, not a one woman job. I have a team of nurses, I have a team of counselors. I refer them to them. If I couldn't help, they can help them as well. And as I mentioned, prevention and awareness is very, very important because before we weren't educated about mental health. Now everyone is talking about mental health, and we need to be educated about mental health and depression. It's we need to get rid of the stigma. That yes, the stigma is very very.
With that note, I would see our parents. We all they grew up in a very our culture. I'll be talking about Arab culture here and our culture. It's very similar to where the parents and they're not being educated when it comes to mental health. See the students, I don't think so they are the issue when it comes to the change. They're young minds, they are still learning, still observing. How do you make or educate the parents so that they are okay? Because if you go to a parent and say no, this person this your child need counseling, it is because it's like no, we don't need the first reaction is a negative from maximum 80% of the parents. How do you deal with that situation?
Difficult parents, of course. So you need to take it slow. You need to give them some time to process their thoughts, to accept the fact that their child needs help. I meet with them. Phone call is the first step, but then you have to meet with the parents, you have to see them, you have to provide them with evidence that their child needs help. This doesn't come between night and day. It's a process of incident logging, following up and investigations, and keeping an eye on that student. I always keep an eye on the students that needs help. So yeah, dealing with difficult patient, it was a challenge for me, and I took the challenge. I told my manager of school operation, bring it on. I'm up to it. I can. I have the ability because by being a bilingual Arabic and English, you can talk to national parents, and they are lovely. They will watch me now, and they are lovely and very understandable. And some of them are difficult, but they get. Yes, education again, education, education, education. I loved working in a school because it's health and education at the same time. It's not about health all the time. There's a very important aspect of education. So I love it.
Everybody talks about when it comes to necessity, education is considered like till today as a privilege. If you can have it, then get education. And it's not about over here only in Middle East or in Asia. Anywhere the rural areas are, not every child is getting an education. And the education is and should be necessity alongside health and water and shelter, whichever are the basic norms. On that note, as you said, you have to deal with sometimes difficult parents, difficult students. How do you keep calm? Because you are doing something which we need to learn to get a leadership award.
Thank you for asking about this because believe me, when you go at the end of the day, you go back home, you feel drained after dealing with so many students and parents and teachers as well. So I try my best to get as good a sleep as I can get, and I walk. I walk a lot. I try to walk at least half an hour every day. My mom keeps me sane. Thank you, mom, because she's my counselor. I get to share all my thoughts with her. I'm privileged that she gets depressed sometime with me because I get to share everything with her. Of course, keeping the confidentiality saved, but I get to share my experiences with her. And I write down. I'm a poet and a writer, and I have a blog. So I write down my reflections, my thoughts, so to get it clear, not forgetting of course my duties to God, so because this is mind and body and soul as well. So
As gem school is the biggest one, I was in one of the gem schools, so I know how amazing my experience was. But I don't think so. The mental health aspect was, or health issues was ever that important before when I was studying. But I am so glad this is something in motion and people are getting educated with that. Yes. So I just want to know, as gym education is amazing in Dubai, in Middle East, are you guys planning to expand gyms outside wherever it is already existed?
Well, for those who doesn't know, gyms as well is present in Africa and some areas in Asia. So it's not only limited to Middle East. So this is very interesting fact that I got to learn. They have a couple of branches in Africa, Asia, and the Middle East, of course. So it's a worldwide. I can say that it's a worldwide institution, and we get to you get to be an innovator in that institution. You get to have the chance to utilize the resources to help your students and your staff. Again, it's not a one woman job. I have a great team of nurses and support staff who help me to guide them and lead them towards my goals and our goals. Because safety first, safety first.
So, being a director, being a teacher, as this conference is not only for health, it's a merge of so many other professionals, different conferences. What you got to learn from all of this experience as a person?
It's been amazing. You get to know people. You get to learn about other people's experiences. You get to connect with people. I connected with a few of them. I'm so excited to have this conversation with them. Listening to conferences, sometimes you get bored. Here, I didn't get bored at all. The topics are really interactive, and I can relate to a lot of them. Being a doctor, being a human being at first, and then being a doctor and medical director. The amount of leaders here, they inspire you. They inspire me, and it's been amazing to be here. Thank you for inviting me. Thank you for the recognition. It's been amazing.
Thank you so much for your time. I hope to see you grow, and I hope to see Gem School all over the world, because as an experienced person from the Gem School, I know it's one of the best at everything. And now, as they're focusing on health, mental health issues as well, which means we are breaking the horizons and we are expanding in all extent, and that all the schools should know that children are very, very innocent and they are still learning, so they need to learn the new education which we are having after pandemic, the medical advancement, the mental health advancement, and they should be aware of it, and they should know there should be no stigma while they want to talk about it. So make a comfortable environment for them and for yourself, and do not care about anything else, just yourself when it comes to your mental health, because that's what makes every other functioning happen all around the world. Thank you so much for your time. I hope to see you grow, and I hope we all grow with her and learn from her. Be kind, and let's have a good time in our lives and make the awareness happen. This is Talia MK signing off.